Humanmetapneumovirus, or HMPV, is a respiratory virus that was discovered back in 2001. This discovery marked a significant milestone in the field of virology, as scientists were able to identify a previously unknown pathogen. It quickly became clear that this virus was not new to humans, but rather had been circulating undetected for decades. Researchers delved into historical medical records and found evidence of HMPV infections dating back many years. HMPV is a common cause of respiratory infections, especially in young children. Pediatricians often encounter cases where children present with symptoms that are later attributed to this virus. Like a stealthy intruder, it often causes mild, cold-like symptoms, making it difficult to distinguish from other viruses. These symptoms can include a runny nose, cough, and sometimes a fever. HMPV is spread through respiratory droplets, released when an infected person coughs or sneezes. These droplets can travel through the air and infect others who are in close proximity. These droplets can land in the noses or mouths of people nearby. This mode of transmission is similar to that of other respiratory viruses, making it a challenge to control its spread. You can also get HMPV by touching a surface that has the virus on it, like a toy or doorknob, and then touching your face. This is why good hygiene practices, such as regular hand washing, are crucial in preventing infection. Symptoms of HMPV typically appear 3 to 6 days after exposure. During this incubation period, the virus multiplies within the host, preparing to cause illness. Most people experience mild to moderate symptoms, but some, especially those with weakened immune systems, can develop serious complications. These complications can include pneumonia and bronchiolitis, which may require hospitalization. While HMPV is a relatively new discovery in the world of viruses, it has quickly become recognized as a common culprit for respiratory illnesses worldwide. Its impact on global health continues to be a subject of ongoing research and concern. HMPV can infect anyone, regardless of age, gender, or background. However, certain groups are more vulnerable to severe illness and complications. Infants, especially those born prematurely, are at increased risk of serious complications from HMPV. Their developing immune systems are not fully equipped to handle the virus. Older adults, particularly those with underlying health conditions like heart disease or diabetes, are also more susceptible to severe HMPV infections. Their immune systems may not be as robust, making it harder to fight off the virus effectively. Individuals with weakened immune systems, such as those undergoing chemotherapy or living with HIV/AIDS, are at a heightened risk of serious complications. Their bodies struggle to mount a strong immune response. Their bodies may not be able to mount a strong enough immune response to effectively combat the virus, leading to more severe outcomes. It's important to note that even healthy individuals can experience severe HMPV infections, although it's less common. They should still be cautious. Understanding the risk factors can help individuals take appropriate precautions and seek prompt medical attention when necessary. Awareness and early intervention are key to managing the risks associated with HMPV. HMPV symptoms often mimic those of the common cold. Runny nose, cough, and congestion are frequently the first signs of infection. These symptoms are often indistinguishable from other respiratory viruses, making diagnosis challenging based on symptoms alone. As the virus progresses, fever may develop, accompanied by a sore throat and headache. Infants may exhibit additional symptoms, such as wheezing or difficulty breathing, signaling potential respiratory distress. These symptoms typically peak within a few days and gradually subside over 1 to 2 weeks. However, seeking medical attention is crucial if symptoms worsen or breathing difficulties arise, as these could indicate a more serious infection. While most HMPV infections resolve without complications, the virus can lead to serious health issues in vulnerable individuals, particularly those with pre-existing conditions. Bronchiolitis, an inflammation of the small airways in the lungs, is a common complication, especially in infants and young children, who are more susceptible to respiratory infections. This inflammation can obstruct airflow, making breathing difficult and requiring medical intervention. Pneumonia, an infection of the lungs, is another potential complication of HMPV, which can be life-threatening. Pneumonia can be serious, especially in older adults and those with weakened immune systems, making recovery more challenging. It can lead to hospitalization and, in severe cases, even death, highlighting the importance of early detection and treatment. Individuals with asthma or other chronic respiratory conditions may experience flare-ups triggered by HMPV, worsening their symptoms. The virus can exacerbate their existing conditions, leading to increased wheezing, coughing, and shortness of breath, which can be distressing and require immediate care.